Well, though much of the conversation recently involves rising COVID cases, that's not the only vaccine health experts say you should consider.
Doctors also want you to get prepared for the flu season. Dr. Leanne Yanni is the Chief Medical Officer at Bon Secours Richmond. Thank you for being here with us here on a Monday. Can you talk to us a little bit about the flu in general? I mean, how is it different from some of those other viruses and other things that are going around this time of the year?
Absolutely. So the influenza virus causes the flu, and it's similar to other respiratory viruses like respiratory syncytial virus, like coronavirus, and also some more milder rhinoviruses. It's spread by droplets, which means if you're coughing or sneezing or touching surfaces where the virus is and touching your eyes, nose, or mouth, you can actually contract the virus. The difference with influenza is it can actually cause severe illness, especially in those who are in high-risk groups. And so we want to be able to prevent complications and even prevent death in those who are at the highest risk.
And what can we expect for this year's flu strain?
So this year's flu strain is going to be very similar to last year, and in fact the flu shot has only changed in one of the 4 variants for the prediction of what flu is going to be this year. We can't really tell yet because the cases have not started to rise, but we expect to see them in the next 30 to 60 days.
I think many folks out there might be a little over-vaccinated at this point with everything everybody's been through, but why is it so important to get this vaccine and prevent against the flu here?
Absolutely. It is so important to get vaccinated. We know much about the prevention of illness from the flu vaccine. First, it reduces the severity of illness. So how sick you get, you're just not going to get as sick if you do get the flu. It also reduces the duration. So if you're planning a trip or you want to get back to work, best to get that vaccine so that you can continue on your activities. Most importantly, it prevents severe complication in those who are at highest risk. And we certainly know that it prevents hospitalizations. It actually reduces hospitalizations by half in patients who are very vulnerable to a severe strain of the flu.
And kind of going off what you just said, who exactly is eligible for a flu shot?
Yeah, so almost everyone older than 6 months old, so our littlest babies, to our oldest, greater than 100 years old, everyone is eligible for the flu shot. There's very, very few exceptions except for those who have had anaphylaxis to flu shot before.
What would those exceptions be?
Yes, very few exceptions would be anaphylaxis or severe allergic reaction. Otherwise, almost everyone is eligible. Less than 6 months old should not get it, but everyone else.
So let's talk about the timing of the vaccine. I mean, I know like my doctor's office, CVS is already sending me alerts saying it's time, come on in. I mean, when should people be getting it? Should it be on their radar now, or should they be waiting another month or 2?
Yeah, so now is a great time. Really now, over the next 30 to 60 days, it takes your body about 2 weeks to develop an immune response to really protect you with those antibodies against the flu. So you want to give time for it to work as we see those cases starting to rise. If you're thinking about going to a large sporting event or other event, or you're going to be traveling, plan ahead at least 2 weeks to get that flu shot and other important vaccines that can really help you enjoy your time away and enjoy your time with people without getting sick or contracting illness to others.
Can you go over what some of the side effects may look like if you get the flu shot?
Yeah, if you get the flu shot, there's very, very few side effects. You might have a little bit of anticipatory anxiety, we call it, actually getting a shot. You might get a little redness or discomfort at the site of injection. And some people's immune system are kind of hypersensitive, and you'll get symptoms from your immune system actually creating the antibodies it needs to fight the virus. But you don't get the flu from the flu shot because it is a killed or inactivated vaccine.
And then real quick, too, we've got up here on the screen, these are places where you guys are offering some flu shot clinics right now.
Absolutely.
Talk to me about these and why these are so important to go to real
So
fast.
you can stay in your car, drive up to these free flu clinics, and get your whole family vaccinated at once. There's wonderfully competent, compassionate nurses who will do that. Roll down your window, roll up your sleeve, and get your whole family vaccinated. So I strongly recommend it.
Thank you so much for being here.
You're so welcome. Thank you for having me, and help us to keep our public healthy.
Thank you very much.